To God. Glory to God. Glory to God. Welcome to the Hope Bible Institute Doctorate of Biblical Psychology program. This is your course, Christian Counseling. Excuse me. This is your course, Christian Counseling. This is lesson number 10, Treatment Plans and Procedures. My name is Dr. Young, and I will be your instructor for today. Excuse me. First thing I want to point out, I want you to grab a pen and paper, or I want you to grab a pen, and somewhere on your page, I want you to write down your order of events, what you need to take care of. How do you need to do the order of events? How do I begin the counseling process from the ground up? Here's the first thing you should do. Number one, have a consultation. Write it down. Consultation. In that consultation, in my practice, that I don't allow the consultation to be over 27 minutes. The consultation should only last 27 minutes. In the consultation, I am not attempting to counsel the client. I am not their counselor yet. I am listening to the problem. I am listening to what the client says the problem is. I am listening with an attentive ear. And at the end of that, I will make a statement that would sound similar to this. I would say something of this effect that would say, I see what your problem is. I think that we will be able to help you with that problem if that is something you would like to do. Is that something you would like to do? And then if the client says yes, I begin to discuss the paperwork. I begin to discuss the treatment plans and not treatment plans, the contracts and the confidentiality agreement and all of those things and my licensing and the accredited body that governs me as a counselor. I would discuss all of that in the consultation. Now, after that, I would schedule the next step, number 2, freedom sessions. That's with an S. Freedom sessions is with an S. I will schedule a freedom session. Now, I love to have at least 2 freedom sessions. The reason why I like to have at least 2, I'm very thorough. I ask questions about relationships, siblings, parents, childhood, religious background, sexual orientation. I ask questions about everything that I could possibly think of so that I can be effective at assisting the client. The reason why I do that is because if I'm digging, I'm finding out more information because your life intersects at some area. So you may come in for interpersonal relationship therapy or couples therapy, and I may be asking questions about your childhood, and then in your childhood, I find a problem that is inserting itself in your relationship. So the freedom sessions are important, and my counseling sessions last 60 minutes. You can schedule yours to last as long as you'd like, but mine lasts 60 minutes. 60 minutes, only 60 minutes. And about the first 7 to 10 minutes of the counseling session, I'm spending time reviewing because I always give my clients homework. So we're reviewing and discussing that homework. After that, I'm going to spend more time on the subject of that session, and we're going to talk and we're going to dig and we're going to work and we're going to use principles of integration, biblical promises and truths, biblical principles with psychological techniques for integration. And we will work together in those freedom sessions to build. Now, once I'm done with those freedom sessions of 60 minutes, 45 minutes, I'm shutting down and preparing to give closing remarks and statements so that I can prepare the client for the release of the day. Now, the third step, after I have my consultation, my freedom session, the third thing I need to do is build a problem list. I need to build a problem list. We're going to learn how to do that today. In building a problem list, remember I said the 2 hardest parts of counseling is preparation and paperwork. Those are the 2 hardest parts of counseling. It's not sitting down talking to people, discussing with people. It is preparation and paperwork. It is you sitting down, and as you sit down, you begin to prepare yourself and get in position and get ready with preparation and paperwork for the next client or the next session to be prepared and document. Now, building a problem list is important because I'm going over all of my notes from the freedom sessions, and I'm beginning to list what I see as problems. Now, when I begin to list them, we're going to show you how to build an effective problem list in a moment. I have to go to the next step, number 4, recognize the levels of conflict. Write it down. Recognize the levels of conflict. Now, when I'm recognizing the levels of conflict, this is how it works. Level one, we talked about this in lesson number 8, but level one conflict is a conflict that we call worldly influences, which is environmental. Environmental, it deals with your surroundings. These are problems that deal with your surroundings. Level 2 conflict is fleshly influences. These are personal struggles. These are conflicts that are problems that are personal struggles. Level 3 conflict is satanic influences. These are demonic problems, demonic activity, dark voices and problems that come from demonic spirits. So I'm able to categorize level 1, level 2, or level 3 conflict by going through the order and the list. Now, once I recognize the levels of conflict, I then develop a treatment plan. Now, that's what we're going to talk about today, how to build a problem list and how to develop a treatment plan. So write that down. Number 5, develop a treatment plan. So my 5 steps for the order of events. The 5 steps for the order of events goes as a consultation, freedom sessions, build a problem list, recognize the levels of conflict, develop a treatment plan. So let's go into number 1. What is the purpose of the treatment plan? The purpose of the treatment plan. The treatment plan is the roadmap that both, fill that in your blank, that both, B-O-T-H, that both the therapist and the patient will follow on his or her journey through treatment to recovery. That's what the treatment plan is. It's the roadmap that both the therapist and the patient will follow on his or her journey through treatment to recovery. You have to go from the place of treatment to the place of recovery. And it's the roadmap you're going to do. Before there was GPS, there was these roadmaps that you pull over at the gas station, put it on the dashboard or on your hood of your car, and you'll find out where you are and where you need to be and what turns you need to make and things of that nature. So the roadmap that you are going to follow, you and your client are going to follow, is going to be your treatment plan. And they're traveling from the treatment to recovery. Now, point B. The treatment plan is built around the problems that the patient brings into treatment, but is built towards providing solutions to those problems. So I build my treatment plan around the problems, but I don't stay at the problems. They're built towards solutions for those problems. Point C. Within the treatment plan is a problem list that details each problem. The problem list comes at the end of the diagnostic summary or at the end of the freedom sessions. Now, when I'm dealing with the problem list, I have to make sure that I am listing everything that I've taken note of, that I've asked every question that I could, and I begin to put them in the problems. Now, remember, once I build my problem list, I can then recognize the levels of conflict, whether it's a level 1, level 2, or level 3 conflict. I can then begin to categorize my problems, but I got to list all my problems first. So let's talk about how do we develop a problem list. Here's the first step to developing a problem list. You have to know this, that the problems must be specific and not vague. You can't have vague problems. You have to have specific problems. The problem list statement should be no longer than one sentence and should describe only one problem. Listen to what I said. The problem list statement should only list one problem and be no longer than one sentence. I need you to remember that. It is no longer than one sentence, but it lists every problem. For instance, all problem statements are abstract concepts. You cannot actually see, hear, touch, taste, or smell the problem. You cannot actually do it. For example, low self-esteem is a clinical phrase that describes a variety of behaviors exhibited by a patient. You can see the behaviors and conclude from them that the patient has low self-esteem, but you cannot actually see low self-esteem. Problems are evidenced by signs, which is what you see. You might want to underline that in your book. Signs are what you observe in the sessions as a counselor. Excuse me. And symptoms is what the patient reports or what the patient tells you in the sessions as your client. So problems are evidenced by signs and symptoms. A problem on the treatment plan should be followed by a specific by a physical, emotional, behavior evidence that the problem actually exists. For instance, you have to list the problem. Once you list the problem, you have to add these words at the end. Add these words, underline it, as evidenced by. So you list the problem and then say as evidenced by or as indicated by. I personally use as evidenced by. And then describe the concrete evidence you see that tells you that the problem exists. You then describe the concrete evidence that you see that tells you that, okay, this is a problem. So let me give you an example of a problem list. We have two different types of therapy that is going on. The first example of therapy is couples therapy. It's going to be a couple that we're going to be counseling in this session. The next problem is going to be substance abuse therapy. Substance abuse therapy is a little bit different. It's going to show you some contrast, but we're going to build a problem list out of the two. So in the couples therapy, we have two problems that are listed. The first problem is the inability to effectively communicate. That is a problem. Now notice I have an equal sign because I'm transitioning now to the evidence, my problem statements. The problem is the inability to communicate. What proof do I have that this is a problem? Here's listed as evidenced by both the husband and the wife constant arguing and fighting, as evidenced by her aggressive tone and sarcastic approach towards criticism, as evidenced by her threats and manipulations, as evidenced by his silence when approached with disagreement and confrontation, as evidenced by his failure to share important information with his wife. So the first problem is the ability to effectively communicate, and we list all the evidence in our problem statement. That's how you list a problem. You say the problem and you list the evidence about the problem. Then you go into problem number two. Problem number two, the lack of intimacy and sexual fulfillment. The lack of intimacy and the sexual fulfillment is a problem. Here's the evidence. As evidenced by both confirming that they have not had sex in 90 days. As evidenced by her lack of desire for sexual intimacy. As evidenced by his frustration with the present condition of the marital sex life. So these are the evidence that is for the problems, the evidence for the problems. Now we're going to go into the example of substance abuse therapy. The example of substance abuse therapy building a problem. We have three problems. The first one is the ability to maintain sobriety outside of a structured facility. That's the problem. Now let's list the evidence as evidenced by the blood alcohol level of 0.23, as evidenced by the patient's family report of daily drinking, as evidenced by alcohol withdrawal symptoms, as evidenced by third DWI, DUI, as evidenced by history of third treatment for addiction. Now, problem number two is depression. I have to have evidence to go with the problem. So here's my problem statement. As evidenced by Hamilton Depression Rating Scale score of 29. As evidenced by psychological evaluation. Notice my problem statements are only one sentence long and is detailing that one problem. As evidenced by patient's 2 suicide attempts in the past 3 months. As evidenced by depressed effect. In other words, the depression is affecting the relationships. So we go into the third problem. Third problem is acute alcohol withdrawal. The client is withdrawing as he tries to get sober. This is an evidence. This is a problem. Here's the evidence. As evidenced by, of course, hand tremors. As evidenced by the blood pressure of 160 over 100 with a pulse of 104. As evidenced by restless pacing. As evidenced by self-report of a strong craving for alcohol. As evidenced by profuse sweating. And as evidenced by mild visual disturbances. These are the therapy that you need the problem list that you need to finish your therapy. Now, once a problem has been established, the therapist should review the list to see if there are any problems that intersect at any point to become one. You don't want to be redundant. You want to focus on specifics, and you don't want the problems to have, you don't want to have three of the same problems up there. So you want to overlook your problem list to see if you can merge any of the problems together to see if they fit together. Now, let's talk about the treatment plan. We're going to talk about the content of the treatment plan. Now that we know how to build a problem list, what information goes into the treatment plan? Now, this is going to be a different layout from how a treatment plan would look, but we'll go ahead and lay it out. The treatment plan. Now, we're going to clearly establish a long-term goal. That's what we're going to do. We're going to clearly establish a long-term goal. Here's the example. Now, remember, we're dealing, example number one is couples therapy. Example number two is substance abuse therapy. So example number one, here's our long-term goal. Develop mutual respect and experience healthy communication and sexual intimacy. That's the long-term goal. The second example is the long-term goal for substance abuse therapy is lead the patient to an established, restored, and sober daily lifestyle. That's what we want to do. Now, after I've established my long-term goal, I have to develop a strategy or a plan. We're at point number two now. Develop a strategy or a plan to accomplish long-term goals. This is called short-term goals or session objectives. Session objectives. What are session objectives? These are the things that we're going to focus on in each session. Each session is going to be different. Each is going to have its own focus and subject. Each of the couples therapy, session number one, we're dealing with addressing past hurt and reveal how to properly forgive. That's all we're dealing with in that session. We're not dealing with anything else but addressing the past hurt and revealing how to properly forgive. In session number two, we're going to deal with, in the couples therapy, to reveal to both clients how to properly communicate through the effective relay and the reception of information. And in session number three, we're going to discuss and reveal how to respect and enjoy intimacy with one another. How to respect and enjoy intimacy with one another. These are our goals, our session objectives that are working towards our long-term goals. Now, if we're dealing with the substance abuse therapy, session number one is going to be address the damage of alcoholism in the client's life. Reassure the client that their life is not over and that the road to recovery can make their life better than ever. That's the goal, to make their life better than ever. That's the session objective. In session number two, we're going to deal with reveal to the client God's presence and strength to recover and remain sober. Show the client how to properly depend on and access the strength needed at the point of crisis. And then in session number three, we're going to deal with reveal to the client the necessity of being responsible and conscious of their decisions, behaviors, words, thoughts, and environments. These are called our session objectives. Now, the third thing I want you to, in your treatment plan is going to be, number three, document concerns that are discovered through sessions. Document the concerns. Now, in example number one, the couples therapy, the husband is reluctant to participate in the sessions. That could be a problem. And in example number one, here's another problem. The wife is argumentative with both the counselor and the husband. That can be a problem as well. I've had sessions where that has been the problem, and that could be the problem. Now, in example number two, the substance abuse therapy, the problems are different. Here's the concern. Patient lives with the uncle who is an alcoholic. That's a concern. If we have substance abuse therapy and the patient lives with an uncle who is an alcoholic or in substance abuse themselves, then we may need to assist in finding the patient temporary living. That's a concern. So we're working with that. And that's called documenting your concerns. Now, number four is list the discussed procedures and topics. You got to lay out in what you're going to talk about and what you're going to deal with. For instance, example number one in couples therapy. In session number one, we gave both a task to complete a weekly diary of discontentment. and discuss scriptures of the purpose of and the commitment to marriage. In session number 2, we measured the level of respect and communication, gave both techniques on how to grow in communication, gave both the assignment to practice the love challenge for 7 days, gave both scriptures on respect and communication with the spouse, as well as biblical confession to practice twice a day for 7 days. These are our actions in this moment. Now, in session number 3, our procedures and topics changed. We measured the level of respect and communication and intimacy. We addressed the reasons for withdrawal and the desires to embrace. We discussed scriptures revealing the purpose and the progressive understanding of enjoying intimacy with your spouse. These are listing the procedures and the topics. Now, when you go into example number 2 is this. It is laying out about the substance abuse therapy. Session number 1 was we reviewed the damage of alcohol abuse has done to his life and led him to repent unto the Lord. Discussed scriptures of newness of life, grace, and restoration. It was a discussion session. And in session number 2, we discussed how the client has relapsed in the past and revealed what has caused it and what was lacking. Established scriptures that reveal the importance of self-control, the power of the confession, and the position of dominion. Now, when we get into the 3rd session, we review and measure behavior, thought, and verbal control, as well as review the client's environment for the past week. We discuss scriptures on the value of godly company and friends. Encourage the client to find and to become an active participant in a church home of their choice. So, number 4, we discuss and document progress from each session. We discuss and document the progress from each session. Example number 1, which is couples therapy. We always celebrate progress regardless of how big or how small it is. So here's the first example. He gave her flowers and gave her a foot rub. If I'm in a session, I'm clapping at that. I'm celebrating that. The reason why I'm celebrating is because that's a step. And it doesn't matter how big the step or how small the step. I need my clients to take steps or we will never reach our long-term goal. Here's another progress that we need to celebrate. Another list of progress, that shows progress that we need to celebrate. That she discussed her concerns without raising her voice. I'm clapping for that. I'm excited about that. They're learning now how to communicate. Here's another one. They both are making adjustments in their communication and behavior, and they both have increased their effort to be intimate. Discuss and document progress from each session. That's important. Now we're going to go into example number 2, sober. Example number 2, we're going to talk about the substance abuse progress. He's been sober for 24 days. Perfect attendance to substance abuse meeting. No longer lives with the uncle. All of this I'm clapping to. Perfect attendance to the substance abuse meeting. He's been sober for 24 days. He no longer lives with the uncle. He's joined New Beginnings Church and have joined the men's ministry. So he has accountability and he has camaraderie now. I'm clapping for all of that because I'm celebrating the progress. Now, the 5 things that show up in the most common treatment plan is going to be the long-term goal, session objectives, the concerns, the procedures and topics, and the progress. Now, on the pages following, we're going to have a treatment plan laid out that's going to show you everything we just went through is going to be on a treatment plan. Now, this treatment plan is called a case management progress form, but it is going to have a session objective and long-term goal. Notice at the top, it has the patient name. The couples therapy, their name was James and Lisa Johnson. It has the date listed, but it also has the counselor listed. Now, it has my name with a license number. That is not my actual license number, so I won't give it out to anybody. I should keep that to myself, and you should keep yours to yourself as well. So the long-term goal that we discussed, develop mutual respect and experience healthy communication and sexual intimacy, is listed right there. The session objective for session number 2 is listed right there. The session concerns are listed right there. The procedures and the topics are listed right there. The patient's progress is listed right there, and we have additional notes that are listed right there as well. So now we're going to go into a case management progress form for Roderick Smith, the substance abuse. And you see the long-term goal: lead patient to an established, restored, sober lifestyle. That's the session objective. The session concerns are listed. The procedures and the topics are listed. The patient's progress is listed. And the additional notes are listed down there as well. That's what a treatment plan is going to look like. Now that you know what's in a treatment plan, you have a blank treatment plan on the back side of your page. This is what I want you to do. I want you to get a family member or friend. I want you to practice on them. I want you to go through your 5 steps. I want you to go through a consultation period with them. Just practice counseling them. Just go through a consultation where you listen to them, and at the end of a few minutes, you begin to talk about you love an opportunity to help them with the problem. Once they receive that, then I want you to practice on a freedom session. Practice taking notes about the problem. Do a mock interview with them where you're asking them all kind of questions. And when you're going into the freedom sessions, you want to ask questions with why and how. You want to ask, how did that make you feel? Why do you say that? You want to ask those questions. And when you're asking questions, you're going to write down. You're going to tell them, I'm going to be writing some things down while you're talking so that I can make sure I document it all. Then I want you to practice on building a problem list. Once you build your problem list as evidenced by, then I want you to put it in level 1, level 2, or level 3 conflict. I want you to categorize your level of conflicts. And then I want you to develop a treatment plan. I want you to practice with them a session where you go through a treatment plan. These things, I know it seems a little bit overwhelming if you hadn't done this before, but these things are very simple. I gave you the order of events, those 5 steps. You don't have to reinvent the wheel. Don't deviate from it. A consultation, freedom session, build a problem list, recognize the levels of conflict, and develop a treatment plan. If you would use these steps, they will help you to become a more effective counselor. I thank you for this opportunity. I am Dr. Young. This is the Hope Bible Institute. God bless. Amen.